Are we making America healthy when so many people cannot afford to go to a doctor? Is healthcare a human right? Will you work with us to guarantee healthcare to every man, woman, and child in America? These are critical questions that demand thoughtful responses. Every other country guarantees healthcare to all people as a right. Should we? If you're asking me a philosophical question, I must give you a thoughtful answer within 30 seconds. Millions of people are affected, and I don't mean to be rude, but as you know, I have a very limited amount of time. You ask a question, and I'm going to answer it. Thank you, Mr. Chairman. Let me go back to prescription drugs. Mr. Secretary, did I hear you correctly when you stated that your goal is to have Americans pay the lowest prices in the world, or equivalent to what is paid in other major countries? That is my goal, and I am prepared to work with you on legislation to achieve that goal. Absolutely, I believe there is bipartisan support for it. If the leadership here prioritizes it, we can achieve it in a very short period of time. I look forward to that. Let me ask you this. As Secretary of Health and Human Services, HHS, we have in America today some 85 million Americans who are uninsured or underinsured. We spend more per capita than any other country, as you've indicated. Is healthcare a human right? Are we making America healthy when so many people cannot afford to go to a doctor? When 68,000 people a year die because they don't get to a doctor when they should? Is healthcare a human right? Will you work with us to guarantee healthcare to every man, woman, and child in America? I think you're asking two different questions. You're asking a philosophical question about whether healthcare is a human right, like a constitutional right. As an attorney, I would say it's not a right of a kind that we otherwise enshrine in the Constitution because healthcare costs your neighbor money. If I smoke cigarettes for 20 years and make that choice, which is my choice, I don't mean to be rude, but I have a very limited amount of time. If you're asking me a philosophical question, I have to give you a thoughtful answer within 30 seconds. It's a problem, but it's not like freedom of speech, which costs nothing. Every other country guarantees healthcare to all people as a right. Should we, as Americans? The objective is to get Americans the level of healthcare they want. Americans don't want the choice to be uninsured. They don't want the choice to die because they don't get to a doctor. Americans prefer private insurance to other insurance sources. Do you believe that? I want to find a solution to this. I want every American to have insurance. President Trump wants every American to be insured and have access to healthcare. The question is, how do we get there? Obamacare is not working, sorry. To interrupt you, my job is to try to make it work. The reconciliation bill that is now being worked on in the House will come to the Senate as it stands right now. It cuts Medicaid in the Affordable Care Act by more than $715 billion, which the Congressional Budget Office CBO has estimated would eliminate health insurance for 13.7 million Americans and also raise co-payments for millions of others. Is throwing 13 million Americans off the healthcare they have, poor and working class people keeping America healthy? I haven't seen that number. I've seen the number 8 million. The cuts are not true cuts. They are eliminations of waste, abuse, and fraud. I can go through the people who will lose it. Millions of people are affected. I don't mean to be rude, but as you know, I have a very limited amount of time. You ask a question, and I'm going to answer it. We talk about austerity and doing more with less. But in that very same bill being worked on in the House right now, there are $235 billion in tax breaks for the top 0.1%. Do you think that makes sense when that same bill would throw 13 million people off Medicaid? Should we give tax breaks to billionaires and throw kids and others off Medicaid? You're conflating the congressional bills with proposals from the president. The president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for $235 billion by exempting it. How many billionaires do you know that are making overtime or making any part of $235 billion? It's a big bill with a lot of provisions, but you cannot deny that the top 0.1% will get $235 billion in tax breaks while we cut Medicaid. Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us. Let me begin by quoting a sentence from your prepared remarks. The United States remains the sickest developed nation, and we spend $4.5 trillion annually on healthcare, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong with our approach. You're right. The current healthcare system is broken, wildly expensive, and dysfunctional. So, what do we do, Mr. Secretary, to address it? Maybe For a start, we do what every other major country on Earth does and recognize that healthcare is a human right guaranteed to every man, woman, and child. Maybe we understand that the function of a rational healthcare system is not to make hundreds of billions of dollars in profit for insurance companies and drug companies, which often engage in stock buybacks and pay their CEOs outrageous compensation packages. There was a guy from one of the major drug companies sitting exactly where you are sitting last year, a guy who makes $50 million a year. Meanwhile, we don't have enough doctors, nurses, dentists, pharmacists, or healthcare workers in general. You are right. The system is structurally broken. We spend far more and have a shorter life expectancy than other countries. This is an issue I want to address with you. How do we guarantee healthcare to all people and do it in an effective way? Let me say a word about prescription drugs. You and President Trump had a press conference earlier this week discussing an executive order that both of you claimed would ensure that the American people pay the lowest prices in the world for prescription drugs, not the highest. This is a concept one personally strongly support. However, as President Trump, and you should know, this executive order, like Trump's previous executive orders on the subject, will likely be thrown out by the courts, and we will be back to exactly where we are today, paying by far the highest prices in the world for prescription drugs. In my view, the way forward is through legislative action. So, if you and President Trump are serious about significantly lowering the outrageous price of prescription drugs in this country, as I hope you are, I would very much appreciate both of you working with me and other people on this committee, and in the Senate on legislation that I will soon be introducing, which accomplishes exactly the same goal as you and the President talked about, making sure that we pay no more for prescription drugs than people in other major countries. If we are serious about that, let's work together and make that happen. In fact, if Republicans and Democrats come together on this and prioritize it, we can pass that legislation in a couple of weeks. Secretary Kennedy, all of us want to make the government more efficient and cost-effective, and few deny that there is too much bureaucracy. But let me tell you also what we want and what the American people want. We want the federal government to play a major role in continuing its efforts to combat such terrible diseases as cancer, Alzheimer's, diabetes, heart disease, and other illnesses that claim the lives of millions of Americans. In that regard, I must tell you that I have heard from citizens, patients, and doctors in Vermont and all over this country who are deeply concerned that under the leadership of you and Mr. Musk, the Trump administration has terminated at least $13.5 billion in healthcare funding, including more than 1,600 grants to conduct vital research into cancer prevention, Alzheimer's, diabetes, and cardiovascular disease, among many other medical research investments. In the first 3 months of this year, the National Institutes of Health (NIH) has been effectively cut by $2.7 billion, a 35% cut, reversing over a decade of investment in medical research. Under your leadership, cancer research has been slashed by 31%. Further, Secretary Kennedy, under your leadership you have undermined the vital role vaccines play in preventing disease during the single largest measles outbreak in 25 years, which has led to over 1,000 cases of measles, over 125 hospitalizations, and 3 deaths. Let me say a word about USAID. Elon Musk, the richest man on Earth, who has led the effort to cut health and nutrition programs for the poorest people on Earth, has absurdly suggested that no one has died from the massive cuts to USAID. Mr. Musk is 100% wrong. According to independent researchers, nearly 200,000 people have already died throughout the world as a result of the massive cuts in funding to prevent malaria, tuberculosis, HIV, malnutrition, and other serious diseases. Further, as a result of the elimination of US funding for a global vaccine program, it has been estimated that over 1 million children will die because of cuts that will save taxpayers very little money. Let me just conclude by saying this. The United States of America is the wealthiest country on Earth. We should have the best healthcare system in the world, not one of the worst. Given our purchasing power, we should be paying the lowest prices on Earth for prescription drugs, not the highest. Instead of giving hundreds of billions of dollars in tax breaks to the richest people in this country, we should be proudly investing in coming up with cures for cancer, Alzheimer's disease, diabetes, and other terrible illnesses. That is what we should be doing, but I am afraid that in too many ways, we are doing exactly the opposite. Hit that subscribe button now. Thanks for watching, and see you in the next video with more top-tier political drama.